This is the main part of the changing rooms where most of the senior doctors get changed. So I meet all my colleagues here first thing in the morning, 7:30, and it could be 8 or 10 of us standing here getting changed. So this is cramped, we bump into each other, we have to share lockers because there's no enough lockers, and privacy is a major issue because the doors are straight out to the corridors where all the staff go past straight into the entrance to the operating theatres. So if I open here, literally it's bang straight into the opening of Theatre 6, which is a major general surgical theatre. We've got first obsolete, very old facilities that are not fit for purpose.
And are we standing in one of those here?
We are. As you can see, these are low ceilinged. They've got materials that cannot be properly cleaned, like wood. You shouldn't have like proper bare wood like we do have in these operating theatres. Are very old. The height of the ceiling means that we cannot have proper operating lights. It's even a danger for the staff because we keep bumping our heads on the operating lights, you know.
Old, small, and not enough.
The anaesthetic machine cost $150,000 and is stored here because we've got nowhere else to store it. Just the width of these corridors means that patients, you can imagine two patient trolleys wheeled one each way. We've got to be extremely slow and careful because we'll be bumper to bumper, literally carrying patients. Yeah, the corridor should be twice about the width of this. Okay, so yes, it is only due to the careful attitude of the staff that safety has been maintained.
The dialysis unit here was out of date and probably too small 20 years ago, and since that time we've had significant patient growth.
Is it still the same size?
Still the same size. And so we've got patients in sort of dialysing in spaces that were offices at one time. One of our rooms is a dialysis maintenance room, but it's had to be requisitioned for patients to dialyse in, and it's, you know, that's simply too cramped and not acceptable.
The building makes it more difficult. We don't have, for example, a negative pressure room that works properly in the children's ward. So we manage that by where we place some children compared with others, by the staff that get assigned, by the road cones we put up.
The whole purpose of having a register of our assets and their current state is so that we can have a clear picture of where our assets are and therefore map out a plan about how we're going to prioritise their replacement. That is the whole purpose of this exercise. The stock take tells us what state they're in, yes, and that many of them are not fit for purpose. To my mind, what I see when I look at these papers is that the Treasury's estimate of needing 14 billion spent in our health system is not out of the ballpark.
We have the promise of a change, better facilities, a stepping stone towards a new build for an acute services block.
But only a stepping stone.
Only a stepping stone.